Good morning. My name is Rekha Chaudhary. I'm an adjunct associate professor of medicine at the University of Cincinnati in the division of Hematology and Oncology. I'm also faculty at the UC Brain Tumor Center and at the UC Integrative Medicine Center. Today, my talk is going to be about food as a chemotherapy. So keep calm, it's only a tumor. When people get a diagnosis of cancer, they're often very scared and feeling isolated. We as oncologists, and that's what I do, is I give chemotherapy to cancer patients, give chemotherapy all the time. I'll tell you my story. I was at University of Toledo for a time period, and I was treating lung cancer patients as well as lymphoma patients. And the lung cancer patients were not me. They were 60-year-old men who had smoked their whole life and developed lung cancer. And I was doing okay psychologically. And then what happened was I moved to Cincinnati. And when I moved to Cincinnati, I started treating brain tumor patients. And brain tumor patients are a little more difficult. The patients were me. They were young women with young children who had never smoked a day in their life or never done anything wrong in their life, and now they have this terrible diagnosis of a brain tumor. And I became quite anxious. My husband has a lot of life insurance, and I became anxious about the kids going anywhere, and because there was all these sudden things happening to my patients. And I read a book called The China Study, which many of you may have heard about. And I thought, wait a minute, I can change my risk of cancer by changing my lifestyle? I've never heard of this. And I had been practicing oncology at that point for about 10 years. And I thought, why haven't I ever heard that you can affect the risk of cancer growth through lifestyle changes? And then I started reading, and I became amazed with the data that's out there. So for cancer patients, there's a difference between curing and healing, okay? Curing is an external treatment that removes all evidence of disease. It's what physicians do, and it's usually on a physical level alone, okay? Healing is an internal process through which a person becomes whole. It's what patients do, and it's on a physical, emotional, or spiritual level. So, for instance, if you break your bone, you go to an orthopedic surgeon. That orthopedic surgeon sets the bone, okay, and may put it in a cast. You may go to physical therapy, and the physical therapist works you through the process. But healing is your own process. You may take some time off work to give yourself some rest. You may not do as much physical activity as you were, or you may do more physical activity to keep yourself stronger. You may try to eat right at home or do things at home that promote your healing from within. And this talk today is going to be about healing. I don't think that healing is intuitive to most people. That one can participate in the fight for life with cancer by working to enhance your own healing is a profoundly important discovery for many people. It was an important discovery for me, and I think many patients intuitively don't think that they can fight their own fight. And this is by, in the book, Choices in Healing by Michael Lerner. Okay. We can fit 1 million cancer cells on the head of a pin. And this is the head of a pin. So by the time you can see cancer cells on a CAT scan, for instance, they're way, way larger than 1 million cancer cells. So the most important part of treating cancer is actually the prevention of cancer and using our own immune system and our own inflammation system and our own body's systems to fight cancer. So I'm part of a group of medicine called Integrative Medicine. Now, Integrative Medicine is a relatively new field. It used to be called alternative medicine or complementary medicine. But we use the term integrative now because we really believe Most physicians who practice integrative medicine believe that we should integrate lifestyle and holistic changes with the practice of traditional medicine. And that's why the name was changed to integrative medicine. Now, I'm an oncologist. I believe in the use of chemotherapy for the treatment of cancer. I believe in the use of radiation therapy for the treatment of cancer. I even believe in surgery for the treatment of cancer. And I think there are many cancers that are cured with these things. So I'm not advocating that you go to your oncologist and say, I'm not going to take my chemotherapy. I'm not going to take these drugs. I'm advocating for a synergistic approach, integrating holistic methods, diet, exercise, stress management, into the treatment of your cancer. Now, why haven't I heard of this before? Why haven't you heard about this before? Why haven't you heard about integrative medicine in the practice of oncology? Well, oncology is a very specific field. The treatment of cancer is very, very, very specialized. And there's a lack of randomized control data. And I'm going to explain this more because this is very, very important. But there's a lack of the number of studies and the kinds of studies that oncologists look for when they're looking to prescribe a treatment. The studies are often small. Most oncology studies are thousands upon thousands of patients. Most integrative medicine studies are very small, 30 to 40 patients. There's a lack of funding compared to pharmaceutical funding. So if you want to bring a new drug, let's say, to the market, you can spend millions to billions of dollars bringing that drug to the market. And millions and billions of dollars of profit. There's not a lot of funding for, let's say, a meditation study or a diet study. So this is really a big problem in conducting studies with integrative medicine. The other thing is a lot of physicians are scared of integrative medicine. And they're scared because of the reasons I mentioned before. They're scared you're going to stop taking your chemotherapy pill. You're not going to show up for radiation. You're not going to do your surgery because of these integrative approaches. And I think that if physicians are educated on this, and they've never been educated on this, there's no medical school teaching. I did not receive any training on diet or lifestyle changes and how it affects the body throughout medical school, nor through residency, nor through my fellowship. So what you don't know scares you. And physicians have never been taught that if I prescribe flaxseed, for instance, to breast cancer patients, that may help their breast cancer. They've never looked at that data. Once they're taught it, and once they're seeing the data, they have been changing their minds. And I've been giving lectures to physicians all over the place. And once they see the data, which I'm going to share with you today, they're like, I'm going to start prescribing that because I feel comfortable with the data. I know it's good data, and I'm going to go forward with that. The final problem with integrative medicine and oncology is that interventions are often subjective. So for instance, how do you measure stress? For me, golf is a stressful experience because I'm not that good at it. For another person, golf may be a very stress-relieving experience. It may be the only stress-relieving experience in their life. So how do you measure stress in somebody's life, and how do you measure what relieves that stress? Therefore, studies on stress reduction and meditation and other interventions to reduce stress are very, very, very difficult to conduct and are not often accepted. Now, diet studies are even more difficult because you can imagine, how do you get someone to stay on a diet for 10 years, let's say, to see an effect? Well, you could put them in a lockdown room. But how are you going to find enough patients to lock down in a room? And where's that funding going to come for? 1 week of a lockdown could cost hundreds of thousands of dollars for just a few patients. So we're going to talk a little bit more about these challenges. How many cancer patients use complementary and alternative medicine, now referred to as integrative medicine? Well, about 65% of cancer survivors have ever used integrative medicine. But how many of them let their providers know that they're using it? as you can see here, only about 23% of patients let their providers know that they are actually using this. And this is really, really concerning because they are on chemotherapy drugs, they're on radiation therapy, and those, they have the diets they may be on or the herbs they may be on cause interactions with those drugs. They really, really need to tell their doctors. So if you are a cancer patient or any kind of patient and you are on an herb or a supplement or trying a very specific diet, you really need to check with your doctor. And if your doctor is not supportive of that, seek out an integrative medicine physician. Okay, so why do I want to incorporate these changes? Well, patients want it, and that's important, but I don't always do what my patients want because sometimes it's not in their best interest, and I'm there to be their advocate. It'll make you feel better. It'll make the chemotherapy easier to tolerate. It'll make you happier. But that's not why we do it. We do it because it works. It will actually make you live longer from your cancer, or if not make you live longer, reduce the amount of cancer. And this is where physicians start to balk at those statements. So I'm hopefully going to show you some data today. And today I'm just talking about diet, but there's multiple data about stress reduction and exercise as well. I'm going to focus on diet today, but how diet can actually reduce your risk of cancer, reduce your progression of cancer, and actually make you live longer. So before we do this, we have to talk about the science of oncology. Now, I want you to know I'm going to present these trials to you like I would be presenting a new drug to the FDA. So in oncology, there are 3 types of trials. There's a prospective, randomized, double-blind, placebo-controlled trial. There's a prospective cohort trial and retrospective trials. All drugs to be considered the gold standard, to be considered the standard of care, most of them have to go through what's called a prospective, randomized, double-blind, placebo-controlled trial. No other drugs will really get approved through prospective trials and definitely not through retrospective trials. Retrospective trials are when you look back at patients and they're inherent with bias. So what is a randomized control double-blinded trial? Here you have patients on the left-hand side, and they're randomized to a treatment group and a control group. And this is randomly assigned by a computer. Then they're given an intervention and they're followed up. And the results are compared to see who dies and who doesn't. So the most important part about this is that you have a randomization that's randomly allocated to a group. There's a control arm, which is often the standard of care. And it's double-blinded, meaning the physician who's administering this treatment does not know what the treatment is, and the patient does not know, as you can see by the cartoon over here. Now, double-blinded is very, very difficult, as you can imagine, to do in a diet study, right? How are you going to blind a patient to what he's eating or what intervention group he's on? How are you going to blind the administrator to what intervention group he or she is on? And randomized is difficult because how do you assure that the patient is on the control group and is taking the control group? So these are some of the problems that we run into when we talk about randomized double-blinded control trials. Prospective cohort trials are a little bit easier to do with diet. You take healthy appearance people with different experiences, and you pass time for 20, 30 years, and then you see who got sick and who stayed healthy and why did those things happen. Now, as you can imagine, this is fraught with bias. And for the investigators, this takes a long time. So if you start a study today, it may not be finished till 2050. And that's a career you spent on that study. This study also requires a lot of money because you need hundreds of thousands of patients to do a prospective cohort trial. Okay, when we look at randomized clinical trial, for instance, this is the randomized clinical trial in lung cancer. There's a surgery arm, a chemotherapy arm, a radiation therapy arm, and as you can see at the bottom, a palliative care arm. In this trial, surgery is doing the best, okay? What we want to really look at is the difference between the arms. Do you see the split in the arms? How there's a space between the arms? That's what we're really looking at. If the curves are kind of crossing over each other as the chemotherapy, radiation therapy, and palliative care arm, that's not as good as having a clean split. The surgery is obviously much, much better than any of the other therapies in this study. Now, most importantly, I'm going to talk about a p-value of less than 0.05. This is when an intervention happened and it is statistically significant. An intervention can happen and you can get an outcome that you want, but that could have just happened by chance. So you need your p-value to be less than 0.05 to be statistically significant. I want you to remember this number because I'm going to quiz you on it later. Okay. The doctor of the future will give no medication, but will interest his patients in the care of the human frame, diet, and in the cause and prevention of disease, said Thomas Edison. Prospective, randomized, double-blind, placebo-controlled trials are where we want. But really, when we're talking about prevention with diet, we have to talk about prospective cohort trials. We have to talk about large population studies. One of the most famous of these studies is the China study, and I think many people are familiar with this by Dr. Colin Campbell and Dr. Thomas Campbell. So what is the China study? The China study is a partnership between Cornell University, Oxford University, and the Chinese Academy of Preventive Medicine. So what happened in this study? They knew the mortality rates from cancer in China between 1973 and 1975 in 65 counties. And this was a time when people didn't really move around China a lot. They went back in the early 80s and correlated these with dietary surveys and blood work from 100 people in each county. 367 variables, 6,500 adults, 8,000 statistically significant associations. This is what 6,500 people looks like. This is a gathering of the UAE flag. So the China study was called the Grand Prix of all epidemiologic studies by the New York Times. Marilyn Gentry, the president of the AICR, which is the American Institute for Cancer Research, says, today the AICR advocates a predominantly plant-based diet for lower cancer risk because of great work Dr. Campbell began 25 years ago. Sushma Palmer, PhD Executive Director, Food and Nutrition Board, U.S. National Academy of Sciences, says, the China study is a well-documented analysis of the fallacies of the modern diet. The lessons from the China study provide compelling rationale for a plant-based diet to promote health and reduce the risk of diseases of affluence. And former President Bill Clinton is plant-based and lost 24 pounds. He sings out the China study and Dr. Campbell as leaders in this movement. Now, how many people have heard of the blue zones? So blue zones are areas, 5 areas in the world where people live to be older than 100, excuse me. And there's several reasons that they live to be older than 100. We can discuss those at a different time. But the areas are Okinawa, Japan, Icaria, Greece, Sardinia, Italy, Nicoya, Costa Rica, and Loma Linda, California. How does that make sense? Well, Loma Linda, California has a high percentage of Seventh-day Adventists. And Seventh-day Adventists are a religion that consider their body their temple. And there is a prospective study there called the Adventist Health Study 2. And it has number of subjects, 96,000 patients. Started in 2002, and it is ongoing. This is what about 100,000 people look like. I'm from Ohio, go Bucks. This is the Ohio State Stadium, almost full. So 100,000 people. And this is what they found from the early data from that study. They found an 8% reduction in overall cancer risk with a vegetarian diet, 23% reduction with GI cancers, such as stomach cancer, 35% reduction with colon cancer, and a 45% reduction with prostate cancer. I have to emphasize that the study is early. It only started in 2002, and prospective cohort trials, as I mentioned before, you have to be followed out for many, many years. So they're seeing promising results. We're hoping to see more. Okay, One of the most important studies being conducted right now is called the EPIC study. It's the European Prospective Investigation of Cancer. This is being performed in 23 centers in 10 European countries: France, Italy, Spain, Netherlands, United Kingdom, Greece, Germany, Norway, Sweden, and Denmark. These are healthy subjects recruited between 1992 and 2000, and there's 448,568 study subjects. This is and subjects with heart attacks, strokes, or cancer were excluded. So these are healthy people. This is what 500,000 people looks like. This is the 1991 protest of the communist government. 6,500 people from Dr. Campbell's early work, 100,000 people from the Seventh-day Adventist study, 500,000 people in this study. This is a huge endeavor, and it's a large amount of people, and the data from it is going to be very, very, very interesting. Some of the initial data that has come out from it, and again, remember, this is very early in data for a prospective study. This is published recently in 2013, and what they found that processed meat, which is the red line here, and the risk of death is on the left-hand side, the hazard ratio, increases your risk of death with your processed meat consumption. Now, the problem with this study is what critics say when I present this study to physicians. They say, well, yeah, the person who's eating processed meat is probably maybe a bus driver or a truck driver who doesn't get a lot of exercise. How can you be sure that that's the only variable? How can you be sure that it's actually the processed meat that's causing the cancer and it's not something else? The processed meat is associated with exhaust fumes. The processed meat, more people who eat processed meat live in a colder area. They don't have enough vitamin D. For instance, the bias and the variables are in the millions. And that's the criticism of prospective investigations into cancer. Even though this study is 500,000 people. I mean, it's a huge, huge study with a huge number of statistics. And even though they're coming out with these positive results, there's still criticism. So we go back to what we really need in oncology. We need a diet study that's prospective, randomized, and double-blinded, okay? With a placebo control arm, meaning an arm that doesn't get the intervention. There is one such study that I'm aware of. So this was published in JAMA Internal Medicine in September of 2015. This is a very, very important study. This is a study done in Spain, and it's a Mediterranean diet and invasive breast cancer risk among women at high cardiovascular risk in the PREDIMED trial, a randomized clinical trial. This is a randomized diet study. So between October of 2003 and June of 2009, realize the study is only now 7 years old. There were 7,447 participants. Very respectable number, huge number of participants for a randomized study. The patients were randomized to a Mediterranean diet plus olive oil, a Mediterranean diet plus nuts, and then a control diet. When they originally started this study, they thought, well, people may see a benefit just because we're paying attention to the Mediterranean diet arm. So what they did is they also paid attention to the control diet arm. So the control diet got as much attention from the investigators as did the Mediterranean diet arm. This is the results from it. Now, in this study, this is measuring incidence or the number of new cases of breast cancer. You want to be on the bottom arm, okay? So what does it show? A 62% decrease in the new cases of breast cancer in just 5 years. Now imagine if this was a drug and you knew you had a risk of breast cancer and you could go out there and buy that drug and decrease your risk of breast cancer by 62%. This would be on the front page of the Wall Street Journal multiple times. The stock of this drug would go up markedly. But most people have never even heard of this study. Now, I was going to ask you, what is that p-value that's important? You guys remember? So the p-value here in this study is 0.02. The p-value that was important, less than 0.05. This is a statistically significant difference in the incidence, the new cases of breast cancer, a 62% decrease with a large study, 7,000 patients. And again, I have to emphasize that if this was a drug, this would be the standard of care now for every single person. So what is the Mediterranean diet? The Mediterranean diet is essentially a plant-based diet. Lots of fruits, vegetables, whole grains, olive oil, beans, nuts, legumes. And they advocate for some small fish and then limited meat, yogurt, and meat, poultry. Be physically active and drink lots of water. Wine is allowed in moderation. So again, a very plant-based diet that's showing a 62% reduction in a randomized, although not blinded, but a randomized control fashion with a placebo arm. And people still question. I still get questions about this study. So how can we prove to oncologists that food can be as impactful as a drug? Well, I used to be one of those oncologists prior to this. I used to say, oh, eat whatever you want. It doesn't matter. Eat your sugar. You have cancer. You should eat whatever you want. I think the only way to prove to other oncologists that it matters is through science. In randomized control data, even though the very best, is also fraught with bias, right? How do we know they were really strict on the diet? How do they know where the randomization was really random? So let's talk about this study. This is a very, very interesting study to me from a food as a chemotherapy perspective. Okay, in this study, women with biopsy-proven ER/PR positive breast cancer. So they felt a lump, they got a biopsy. They were waiting for their surgery to do the lumpectomy or mastectomy. And they were randomized in a double-blinded, placebo-controlled manner. So the doctors didn't know what they were getting, nor did the patient, to a muffin with 25 grams of flaxseed versus a muffin without flaxseed. Now, the muffin's in a little silver foil container. So neither the doctor nor the patient knew which arm they were on. They knew they were part of the study, but they didn't know which arm they were on, okay? And then 10 to 14 days later, they had their completion mastectomy. So 25 grams of flaxseed, 10 to 14 days, double-blinded, placebo-controlled, randomized study, okay? Perfect study, right? So I have to talk a little bit about Ki-67. Ki-67 is a measure of cell turnover that we see when we look underneath the microscope. If you have very low cancer cell turnover and your Ki-67 is less than 7%, you have about a 95% 10-year survival, 100-month survival. If your Ki-67 is greater than 20% of your cells are turning over when they look under the microscope, then your survival drops down to about 50%. Significant difference, okay? And as you can see, this p-value is 0.001, very significant difference. Okay, now, on the left-hand side of your screen, you'll see the control arm. P-value not significant. No difference in the patients that got the muffins without flaxseed. In the patients that got the muffins with flaxseed, they saw a significant decrease in the Ki-67. Remember that p-value, 0.05. This p-value is 0.001. Very, very, very significant p-value that says that the Ki-67 decreased with 10 days of a flaxseed muffin. Okay? Another thing. I don't know how many people have heard of apoptosis. Apoptosis is programmed cell death, and this is one of my favorite electron microscope pictures. This is a cancer cell undergoing cell death, and cancer cells in our body should undergo programmed cell death. When they don't, we have cancer. That's what cancer is. When they're not going through apoptosis like they should, or programmed cell death. So this is a cell dying on its own. Again, The arm on the left is the control arm, the no flaxseed arm. P-value 1. There was no difference. This is not statistically significant at all. The p-value on the right are the patients that received the flaxseed muffin. P-value 0.007. 0.007. Wow. So all of a sudden, we have a very, very, very significant difference with 10 days of flaxseed muffin. Is food can be used as a chemotherapy? Yes. We need more studies to find out why. And we need more very, very scientific studies like the one I just showed you. These changes they saw are the same changes that you see with tamoxifen, the pill. So you need everything to fight cancer: exercise, diet, stress, and traditional medical therapy. So why should you incorporate this into your life? Not because it's going to make you feel better, but it does. The diet will make you feel better, but it works. It really changes your cells at a molecular DNA level, and I'm going to show you that. This is a famous study published by Dr. Dean Ornish. 93 patients with low-risk prostate cancer were on a wait-and-watch treatment. Patients were randomized to a control arm and a lifestyle arm. The experimental arm were asked to adopt a low-fat, plant-based diet, to exercise, and to practice stress management, and to attend group support sessions. So everything they were supposed to do. At 2 years, the control arm, 27% of them had to go on to have surgery because their cancer progressed. Only 5% of the experimental arm required surgery. 5 times the amount of people had to go on to have surgery because they were on this control arm. But more importantly, what happened at a molecular level? So you may have heard of telomeres. Telomeres are like the caps on shoelaces. So telomeres, they keep the shoelace from unraveling. And telomere shortening, as you can see, the guy on the right-hand side has a shorter telomeres, is associated with disease risk and premature death. What happened in the Dean Ornish study? Well, the lifestyle intervention group, their telomeres actually grew. The patients that practiced healthy diet, physical activity, stress management, social support, their telomere grew. The other people, their telomere shortened. They actually they became younger, for lack of a better word, if they practiced these 4 things. Now, does adherence matter? Does it matter how strict you are? Well, the patients that on the bottom is the adherence score. How strict you are is on the x-axis. And then the increases in the relative telomere length is on the y-axis. As you can see, it's a straight line. The slope equals 1. The telomere lengths increased proportionally with how strict you were with your lifestyle changes, your exercise, your healthy diet, your plant-based, low-fat diet, your stress reduction. You're increasing your youth by every time you are more adherent to those things. So I bring up this study because I think it's important. It's a lifestyle change, not just one aspect, but I want to emphasize how important this is because it's not changing psychologically. This is not just changes in your brain, placebo effect. These are changes that are happening on a molecular, chromosomal level, so small that we can't see it with a microscope. One last study. This is a very, very interesting study to me. 10,000 patients took the MMPI. I don't know how many people have heard of the MMPI. It's the Minnesota Multiphasic Personality Index. And they grouped them into pessimists and optimists. 18 years later, 534 of those patients developed lung cancer. And the patients were divided into an optimistic group and a pessimistic group. And it's really funny that they were pessimists themselves. They call it a non-pessimist. And so the optimistic group is the black line, and the pessimistic group is the dotted line, the dashed line. Now, as you can see the separation between the 2 curves. If you're an optimist and you have lung cancer, it improves your average survival by 6 months. Okay? Look at the p-value in this study. Again, very, very strong study statistically. 0.01. 0.01. That's really, really, really very strong statistically. So if you're an optimist, 20 years before your cancer diagnosis, it makes a difference. Tarceva was recently approved for lung cancer. It was rushed through the FDA. It's a new drug. It improved median survival by 3.4 months, and it was rushed through the FDA for approval. Cost of Tarceva, $3,000 per month. Cost of optimism, free. So, by coming to these lectures, by reading about it, by making changes in your health, you're already by definition on that top line. You're already by definition an optimist. So I got to meet Oprah. It was a very exciting moment in my life. It was wonderful. And one of the lectures she gave was choose love and not fear. And before I heard this lecture, I always thought that the opposite of love was hate. You know, I always thought you love or you hate, but it's not, it's fear. Think about why you yell at your kids. You yell at your kids because you want them to grow up to be good people. You're scared. You're scared they're not going to be good citizens, and you want them to grow up to be good people. So you're not yelling at them because you hate them. You're yelling at them because you're scared. When I started this journey, I was scared. Now, I'm trying to choose love and make these lifestyle changes. And I challenge you to make these changes, not out of fear that you're going to get cancer or you're going to get heart disease or you already had a heart attack and you want to make these changes. Do these, make this a loving change. So I call it living luxuriously, living the spa-like lifestyle, the journey. And it is a journey. So I want to be this lady eating that beautiful salad with the beautiful skin and behind the trees rather than this lady. I want to live the spa-like lifestyle and live and travel that journey. So this is Tuscany, Italy. I had the good fortune to go there. It's the Monteverdi Hotel in Tuscany, Italy, and to give lectures there. And the one thing that really appealed to me was this quote that I read there in a book on the table. Nothing can cure the soul but the senses, just as nothing can cure the senses but the soul. And that's why it's very important when you start this journey in preventing your chronic diseases, whether that be cancer, heart disease, diabetes, you start it with your soul and you start it with love.